Assalamu alaikum my dear students. Today it is the second part of the ECG lecture. So today I would be demonstrating you about first of all the heart sounds. We know that one cardiac cycle constitutes 4 heart sounds. So talking about the number first heart sound. So number first heart sound appears after ventricular systole. When ventricular depolarization is completed, so first heart sound appears. Second heart sound, talking about second heart sound appears during the ventricular diastole phase. Talking about the third heart sound, it appears when the blood is drawn from atria towards ventricles. So during this third heart sound appear. Fourth heart sound appears during atrial depolarization. So these are all about the this is the all info about the 4 heart sounds. Now I would go into the deep detail about the segments and the intervals, that during which occasions those segments and intervals appear. So first of all, drawing that ECG. So this is the ECG. This is the P wave, Q, R, S and T. Now talking about first of all segment, we know that the first segment we have got is the PQ segment. Now what does this PQ segment demonstrate us? The PQ segment actually demonstrates the atrial depolarization. And it appears during fourth heart sound. This is all about the PQ segment. This is the PQ segment which is present between the P wave and Q wave. So after this we have the ST segment. This is the ST segment. So ST segment, it is the plateau phase of the action potential of the cardiac muscle. I have told you in the previous lecture, when discussing about the action potential of the cardiac muscle, it appeared like this, and then there was this phase, and then so this was the plateau phase of the action potential of the cardiac muscle, in which there is the sustained depolarization of the ventricles, is still continued. So this ST segment actually depicts as the what? Depolarization of ventricles. Depolarization of the ventricles that appears as a plateau phase of the action potential of cardiac muscle. So that is all about the ST segment. Now talking about the last segment, which is the TP segment. So after this wave, the second wave would appear, and this is the P segment. So you can see that the TP segment actually depicts the relaxation of atria and ventricle. It depicts as the relaxation of relaxation of atria and ventricles. Atria and ventricles. Excitation. So you can see that the T wave is representing as the repolarization of the ventricle. So repolarization of the ventricle has been completed, and also the excitation of the atria is yet to begin. So during this phase, in between this phase, what is happening? The relaxation of atria and ventricle occur. So TP segment is actually depicting as the relaxation of the atria and ventricles, during which the filling of blood occurs, because we know that in the relaxation phase blood filling occurs. So that is all about the segments. Now talking about the intervals. Now we know that first interval we have, it is the PR interval. The PR interval, which is constituting this wave, and this segment, and then this Q wave. So this is the PR interval. So PR interval is actually showing as the atrioventricular conduction. So PR interval is depicting as the conduction of impulse from the atria towards the ventricles, and its duration is 0.02 seconds. Now talking about the another interval, we have the QT interval. QT interval is 0.35 to 0.45 seconds, and QT interval actually shows us, you can see that what waves does QT interval possess. We can see that QRS complex, which is showing the ventricular depolarization, then we have this ST segment, and then we have this T wave. So here ventricular depolarization occur, here the ventricular depolarization is sustained or continued, and then T wave is also there. So QT interval shows us ventricular depolarization, and if we include T wave, so it also shows repolarization of ventricles. Now talking about two conditions, we have first of all the condition known as the hypocalcemia. So during the hypocalcemia, we know that outside calcium ions are less, so QT interval is shortened. QT interval is prolonged. During the hypocalcemia, less number of calcium ions are coming from ECF into the cell, so that's why what happens that QT interval is prolonged. Talking about the another case, hypercalcemia, QT interval is shortened. Why QT interval is shortened? Because there is the hypercalcemia, more amount of calcium ions are present in the ECF, so more amount of calcium ion would come from ECF into the cell. So this QT interval will short. QT interval will be shortened in the case of hypercalcemia. Now last interval we have, it is the RR interval. So RR interval is present between the two QRS complexes, of two ECG waves. Like we know that, like this is the T wave, then this is the P wave. So you can see that the RR wave, the RR interval. So RR interval is present between the QRS complexes of two ECG waves. QRS. So you can see that from here till here. So this is the RR interval, and it actually depicts as the one complete heartbeat. We know that RR interval constitutes QRS complex, the T wave and P wave. So it constitutes whole one heartbeat. RR interval constitutes whole one heartbeat. So in this particular lecture, I have explained you the you can say deep aspects of the segments and intervals, and also I have told you about the head sounds. Hope you have understood it well. Thank you.